Ovarian reserve tests. Let's discuss about these. So, ovarian reserve tests are available in various forms. The first is the biological. Obviously, the most important parameter is the chronological age of the woman. Then there are biochemical, biophysical, and histological testing. The biochemical can be divided into static and dynamic test. The static test, which are the most common way to assess the ovarian reserves, that is the FSH or FSH to LH ratio, estradiol, and anti-Mullerian hormone. Dynamic testing or the provocative tests involve the clomiphene citrate challenge test. Biophysical test means the ultrasound to assess the intral follicle count, ovarian volume, or the ovarian blood flow. While histological testing, although not done anymore, is like ovarian biopsy. Both biochemical and ultrasonographic markers of ovarian reserve have poor predictive value for prediction of conception because they are just a quantitative markers. They are not qualitative markers. The quantitative markers only tell how much are the reserves present, whether they will actually lead to conception. No such single test is available. Let's discuss the tests one by one. First is the basal FSH and estradiol concentration. When should we take the test? It is a time bound test. It is obtained during the early follicular phase. Best time is day 2, 3, and 4 of the cycle. It should not be taken beyond day 4. And why? Because the FSH starts rising as the follicle recruitment starts, along with the estradiol, which also starts rising because of the release from the Graafian follicles. FSH levels more than 10 international unit per liter have high specificity for predicting the poor response to stimulation, but sensitivity is low, that is 10 to 30%. Why it is it shows why high FSH shows poor response to stimulation? Because higher FSH results when there is the we already discussed in our previous video, the smaller cohort, as the cohort of the follicles, they start decreasing as the cohort of the remaining pool of the follicle, they start decreasing. So there is decreased in inhibin, and when inhibin decreases, it has a decreased feedback inhibition on the FSH, which will lead to increase in the FSH. So lesser follicles, lesser inhibin, more FSH. So as FSH increases, it shows indirectly that the follicular pool is less. But FSH has wide intra and intercycle variations. An isolated increase in FSH level is one of the earliest indications for reproductive aging in women. And one thing more, we must always do estradiol along with the FSH. This is very important point whenever we are measuring the FSH and estradiol. Why? Because sometimes, because of some follicular cyst or functional cyst, the estradiol is more, which will lead to inhibition, feedback inhibition on the FSH. So the FSH level will come as low. So that will be the false negative report of the FSH. FSH is low only because the estradiol is more in the body. That's why the FSH is low. So FSH and E2 must be done together. This is a very important point. Now coming on to clomiphene citrate challenge test. It is a provocative test. Clomiphene citrate is given in the dose of 100 milligram per day on cycle day 5, 6, 7, 8, 9. That is for 5 days. On cycle day 3 and 10, the FSH along with estradiol are measured. Then the smaller follicular cohort in aging women produces less inhibin B and estradiol, resulting in less negative feedback inhibition on clomiphene induced pituitary FSH rise, causing an exaggerated increase in FSH concentrations. A frankly elevated cycle day 10 FSH concentration can identify women with decreased ovarian reserve who might otherwise go unrecognized if evaluated with basal cycle day 3 FSH and estradiol level alone. So, clomiphene citrate challenge test, although it is not done these days, but it is a good method to know who are the women who have decreased ovarian reserve and who are the women who will show a poor response to the stimulus. Inhibin B, it is another test to assess the ovarian reserves, although it is not that a famous test. Inhibin, we all know, is secreted during the follicular phase by granulosa cells or small intral follicles, and its concentration increases in response to stimulation. But just like FSH, it has wide intra and intercycle variations, and it is not regarded as a reliable measure of anti-Mullerian hormone. It is a very promising screening test. Anti-Mullerian hormone is produced by granulosa cells of preantral and small intral follicle. So this is very important to know that which are the cells which produces AMH. It is the preantral and small intral follicles. Low threshold values have good specificity for poor response to ovarian stimulation. Bologna criteria takes AMH value less than 1.1 nanogram per ml as threshold for lower ovarian response. Intral follicle count, it is the easiest and most practical approach. Intral follicle count relates to the number of follicles remaining. The, the AFC correlates well with oocyte yield in IVF cycle. They have high specificity for predicting the poor response to ovarian stimulation. Lesser the follicle count is, lesser the response to the ovarian stimulation is. Bologna criteria takes AFC 5 to 7 as threshold for abnormal reserves. Ovarian volume. Ovarian volume is calculated as length into width into depth multiplied by 0.52, and but the ovarian volume has high intercycle and intra-observer variability because it is an ultrasound based. Anything which is ultrasound based will have intra-observer variability. A lower ovarian volume, that is less than 3 ml, has high specificity but widely ranging sensitivity for predicting the poor response. Ovarian volume has very limited clinical utility as an ovarian reserve test. Now, what WHO 2025 has to say about the ovarian reserve test? Since we have discussed so many ovarian reserve tests like FSH, estradiol inhibin, AMH, AFC, ovarian volume, so which is the test which should be done to check for the ovarian reserve test? So WHO 2025 guidelines came up with the, if ovarian reserve diagnostic testing is conducted, WHO suggests using intral follicle count, anti-Mullerian hormone, or day 2 day 3 FSH as the test which should be used for ovarian reserve testing. Apart from these, other tests like clomiphene citrate challenge test, inhibin B, ovarian volume, all these things should not be used to assess the ovarian reserves. So thank you everyone. This was all about the ovarian reserve test. We will be coming up with the newer videos on based on the female infertility. Thank you.